Dr. Sarah Tofilon is one of our oncologists here at the Norma Schmoker Cancer Center.
My father was a longtime physician here, and my mom was a nurse in many areas at the hospital. And I tried to not go to med school purposefully because I wanted to do something different, but it just kept drawing me back, and I'm where I'm meant to be, I think.
And you can tell that by the way you care for patients. So you're a Fort Dodge native.
Yes.
And so coming back to care for your community, what a challenge and a joy that must be for you.
You have relationships with them from when you were a child and growing up, and then you have a different relationship with them when you're grown. But it's also some of the most rewarding stuff to take care of former classmates, former teachers. It's a blessing to be able to give back to the community that way.
I can imagine the trust that you have because they know you and they know your heart for care. And so how cool is that to be able to be in a community where you can do that?
Patients actually give us so much inspiration here. It is amazing to see the grace they have in such difficult situations. The family members who care for their loved ones again and again and again and advocate for them. We really probably get as much from the patients as we give to them.
The Norma Schmoker Cancer Center has recently been accredited by the Commission on Cancer. It's a reaccreditation for us this year. Can you tell us a little bit about what that means?
In order to be certified, we have to meet certain standards. It is important for us to make sure we're giving as good of care as we can to patients and making sure we're giving that quality care. And we're always having to do improvement projects as part of the accreditation. And I think that pushes us to come up with new ideas and new ways that we can better care for patients.
The Norma Schmoker Cancer Center has grown a lot.
Slightly.
With you here. And so tell me a little bit about what it was like when you started and what you see with the cancer services available here today.
When I started, I had 4 staff members, and now we've grown to over 10, and we could probably use more. It's just grown and grown and grown, and it's wonderful that patients are able to stay close to home to get their care instead of having to travel so far when they're not feeling well.
The convenience that we have with excellent caregivers, the convenience we have of just having people here close to home. And being able to do both medical oncology and radiation oncology right here. We've seen rising rates of breast cancer, prostate cancer, lung cancer. As an oncologist, give us some advice.
For those 2 cancers, breast, prostate, and lung, we have screening tests available to try to pick those cancers up early. So it's very important that patients see their primary care provider and talk with them about what tests would be appropriate for screening and about their risk factors. Being at a healthy weight, exercise, avoiding tobacco and alcohol can influence the rates as well.
Early detection is the key to survival.
Absolutely, absolutely. And that's why those screening tests are so important.
We're really blessed with wonderful physicians, wonderful staff, and really just a great, wonderful group of patients. We appreciate the partnership with McFarland Clinic and allowing you to spend your time here and your gift of time here to our organization. We know that you have done wonderful work.
Thank you.
For our patients here, and they really are blessed by you.